Welcome back to KimFoot.com. This is Dr. Kim. We'd like to talk about today the first 3 causes of the heel pain epidemic out of the 7 causes. The first cause will be the structural misalignment of your foot. Your foot is like a tripod, and these 3 legs of the tripod has to be perfectly balanced, just like your foot needs to be balanced to work perfectly. Unfortunately, most of us have one of the legs too short. Now this leg is on the big toe, this leg is on the little toe, and this leg is on your heel. When this side of the leg on the big toe is shorter, when you put it down on the floor, your foot is going flattening down into that direction. We call them flat foot or collapsing arches. Now this is type of foot that's very common, including myself. I suffer from this particular problem. So when you put your foot down, the whole foot is going that direction, internally rotating in, making that plantar fascia that goes from the ball of the foot to the heel stretch out, causing the plantar fasciitis. This gets aggravated by obesity, gaining weight, or diabetes, pregnancy, or different arthritis condition can cause this foot to be collapsing into that area, causing this foot to be imbalanced and causing plantar fasciitis. The other side is when this little toe area gets shorter. When you put your foot down, you're walking on the outside of the foot. This makes this foot a very rigid and very high arch foot. This is not as common. However, the problem with this type of foot is it's very rigid foot. In other words, when you put your foot down, rather than flexing and absorbing the shock, it doesn't absorb the shock too well. That makes this heel area hit it really hard, making the heel pain get worse. So to have this perfectly balanced foot is not easy, but it's possible, and then you definitely need to work toward getting that done. The second cause of the heel pain epidemic, improper shoes. Now when you're looking at shoes like this is a high heel that a lot of ladies like to wear. It needs to have the heel counter and it needs to be stiff. The heel counter is there to protect your heel from moving too much, which is very important to prevent the heel pain. Next part is when you twist your shoes, it cannot be twisted like this because the arch support needs to be there to protect the heel from moving too much. And third, when I press on the heel area, it needs to give some cushion. However, this type of shoes don't have any cushion here to take pressure off your heel area. And these are the wedges that a lot of ladies love to wear. They're very comfortable. However, it does not bend on the ball of the foot. It needs to bend here to prevent your arch from stretching too much. So these wedge shoes are not good for the heel pain. And the other part about the heel pain is that it does not like very hard surfaces, such as concrete, asphalt, marble floors, hardwood floors. These floors need to be avoided at all times to prevent any further damage to your heel. The third cause of the heel pain epidemic is too much sitting in bad posture. And we're all guilty of this. We call this a sitting disease. We're sitting way too much now. Average Americans sit anywhere from 12, 14, 16 hours a day now in front of a computer, doing a desk job, or sitting, eating, driving, or any kind of sports activities. Even your whole body is moving forward in a sitting position. So this tightens up the front part of the leg on the hip area, and also it tightens up your back, your posterior muscle groups, we call it, the hamstrings, the calf muscles. This tightening up all of these muscles make your foot come down a lot harder on your heel area, making your heel pain to be worse. We're going to talk more about the exercise that I devised on my own to help this condition in the later videos, but I want you to think about that right now at this point. On the next video, we'd like to talk about the 4 more causes of the heel pain epidemic. We'll see you there.